commend the government on their changes to the scope of practice for nurses. This is a very welcome change, and I want to acknowledge everyone who's been pushing for this change for many years now, and the hard work that has gone into making the case, building up the evidence base, and then the government for actually going ahead with it. I am confused, though, about the government's reluctance to allow prescriptions from podiatrists to simply be covered by the PBS. As Senator Ruston said, this is already happening. Podiatrists can prescribe, but Australians just have to pay a lot more. And here in Canberra, where we have a shortage of GPs, it's very hard to get in to see a GP, certainly at short notice, almost impossible. And we have the highest gap fee in the country, an average $50 gap fee. And so we're essentially saying to mostly older Australians who go and see their podiatrist, have something prescribed, that they need to book in to see a GP, to go to the GP, to get the script that the podiatrist said that they gave them, prescribed by the GP, so they're covered by the PBS. We hear a lot about productivity, we hear a lot about cost of living, we hear a lot about caring for older Australians. This seems like such a sensible move for the Parliament to say, podiatrists are already prescribing. We accept that, it's working well. We're simply going to cover those prescriptions with the PBS. And so I really think we need an explanation from the government as to why they're not backing this change. This seems like evidence-based policy. It seems like it's in the best interests of all Australians and actually builds on the health system that we have. And so on behalf of Canberrans, I want to raise my concerns about a government that won't back an amendment from the Senate that clearly, I think, is in line with what most Australians would probably already think happens. If you can prescribe, you're covered by the PBS.
David Pocock nails it right from the start. He welcomes the government's big move to let nurses prescribe under the PBS, a long overdue change that actually puts more boots on the ground where doctors are thin on the ground. Fair play. But then he cuts straight to the nonsense. Why on earth won't Labor back the same common-sense fix for podiatrists? These qualified pros can already prescribe, but patients, mostly older Aussies, get slugged full price. In Canberra, with sky-high GP gap fees and waiting lists from hell, you're forcing pensioners to chase down a GP just to rubber stamp what the podiatrist already sorted. Pocock puts it plainly. We're essentially saying to mostly older Australians who go and see their podiatrist, they now need to book in to see a GP. That's not healthcare efficiency. That's bureaucratic busywork that wastes everyone's time and hits taxpayers and patients in the wallet. We bang on about productivity, cost of living, and looking after seniors. Here's a simple, evidence-based way to deliver on all three. The Senate backed it, cross-party, including the coalition. Labor knocked it back in the House. More consultation, they say. Meanwhile, everyday Canberrans and patients across the country keep paying extra for no good reason. This isn't radical reform, it's basic common sense. If a health professional is trusted to prescribe, their patients shouldn't pay through the nose just because the script didn't come from a GP. Pocock's calling out the gap between the talk and the walk, and he's right to.